Hi, I'm going to show you today a few vertical reflexology techniques for hands that are just a little bit more unusual than the usual weight-bearing hand techniques. And apart from that, I've got two books that are rather treasured books from my collection, and one is by William Fitzgerald on zone therapy, and the other is by Dr. Joe Shelby Riley on zone reflex. And they're both facsimiles, but from the 60s and 70s. And at the end of my little hand reflexology demonstration, I'll show you a few pages and talk about them. So vertical reflexology is an adjunct really to classical reflexology, where the weight-bearing hands and feet are worked very briefly, maybe at the beginning and end of a classical treatment, where the dorsal reflexes are worked rather than the palmar or the plantar reflexes. But the idea behind vertical reflexology is that the weight-bearing reflexes are perhaps slightly more receptive or energetic at times when we work, and also we can approach the whole of the body three-dimensionally through the hands or feet. So all the reflexes that we're used to on the palmar or the plantar of the feet are also worked exactly the same on the dorsum. So today I'm just going to show you some weight-bearing work for headaches, for sinus problems, for neck ache, and almost everything can be treated weight-bearing, such as headaches, on fingers and thumbs, just for a few minutes. And with classical reflexology, we would be working the passive hands in the normal way, and this is a very good little technique for headaches, holding the top thumb joint, just moving the thumb back and forward. That can sometimes help. With VRT on the hands, we usually work the weight-bearing hand, and we can work each part of the fingers, thumbs, top of the hand, the dorsum. But today we're going to look at weight-bearing fingers and thumbs, which gives us a different dimension. So any reflexes that are on the thumbs and fingers, we can approach just for a few minutes, maybe at the end or beginning, or as first aid on their own. So you can use a book. You could be sitting on a chair and just put a tray on your lap, or stand and put your hands on a hard table. And it's good for self-help as well as for other clients or family and friends. And the idea is that you take one hand at a time, and in the case of working the neck, we could start at the base of the thumb, and we weight bear the hand just a little and work round. And if there was a really deep pain, maybe in the medial or lateral side, you could hold, just stimulate and hold for about 30 seconds maximum, but normally 5, 10 or 15 seconds is enough. You always work both hands to balance the body. So if you have a pain in the neck or a headache, you can go from one hand to the other. If you have a headache, then obviously the top of the thumb area, the head-brain area is important. So again, making sure you're still weight-bearing, you can work round. And then the secondary fingers are all helper areas for the head and the brain. So you can work right across and repeat on the other hand. If you have toothache, then there are teeth reflexes on the knuckles, the two knuckles of the fingers, and you can work those. And obviously follow your own charts and your own guidelines of where the reflexes are, but you're just working in a slightly more perhaps receptive way, using weight-bearing work on the same reflexes we use anyway. if you have sinus trouble, then it's very useful to work the fingers, not the toes, because you have a big raft of soft fleshy reflexes. And in this case, we will use just a little bit of lotion or cream just to run your fingers down, just to ease the sinuses. Sometimes just rubbing your fingers down. Otherwise, you can do little caterpillar bites. Don't forget the thumbs, and then you repeat on the other fingers. So it's a very quick but very effective way of working. And the last thing we're going to look at with the weight-bearing fingers in this mode is Ingham's referral areas, and I'm going to talk about cramp. And so if someone has cramp in their toes, which would be excruciating and they couldn't bear to have their toes touched, they can immediately grab their fingers, maybe passively in bed, but if that doesn't help, they can get up, put their weight-bearing fingers down, and then do exactly the same using the referral areas. So the toes are in cramp, the referral area finger reflexes can help that, and you could repeat on the other side. I'm now going to show you a couple of techniques for cramp in the calf first. So you could weight bear your hand a little bit. This is the referral area for the calf. So the lower arm, and we're at the top part of the lower arm beneath the elbow, and if you cramp in your calf, you can just squeeze round. And often just squeezing round this part of the arm when you're lying in bed can sometimes relieve cramp anyway. But if that doesn't work, you can stand up. And the third demonstration, for cramp, which isn't really cramp, but it's restless legs. It's another way of perhaps helping if the legs are restless, or if gripping the calf doesn't help, or cramp is further down the leg, then you can work in a different way, just working down the reflexes quite firmly, just almost stripping down the muscles. And that again, you can be done both for cramp or restless legs before you go to bed as a preventative measure. So those are just a few little hints about how you can use vertical reflexology in a slightly different way. And I'm now going to finish by just showing you these two books. Over 30 years I've gathered together all sorts of books, reflexology books and other complementary health books, but these are very special. They're facsimiles from the 1960s, and they show from the Shelby Riley book, Zone Reflex. These are his foot charts, and these are his hand charts. This book by Shelby Riley, who worked with Eunice Ingham, was reprinted in 1961, but it also was originally printed in 1924. And the 1916 edition was by Dr. William Fitzgerald and Dr. Bowers. This was zone therapy, the very early stages. This was 1916, reprinted in 1978. And again, there's some interesting illustrations here. There's hand reflexology for pain using pressure. And we have another one of hand reflexology. We're just going to nip up here to show you the famous pegs on the hands. This is to help the deaf hear, which I think is a rather ambitious claim, and we certainly wouldn't be using that now, but these are the very early days of reflexology, not as we know it now, but zone therapy. So it's the history behind what we do. Both Bowers and Fitzgerald were keen on using combs, so pressure on the hands, and this was the idea that perhaps pressure using a comb would help reflexes to help childbirth. And then we'll just leap to his wider range of charts at the end, which shows the zone therapy reflexes. So we're really looking at a little bit of history here, and that is the sort of conclusion to what I'm going to show you today. But the Fitzgerald book is available if you Google on Amazon. You can buy modern day copies of his works. I think maybe Zone Reflex by Dr. Joe Shelby Riley is a little more difficult to find. But I hope you can experiment using the VRT techniques on the fingers, and I hope you found it interesting. Thanks very much.